Good morning. My name is Erin Holliday, and I'm a nurse, and I would like to speak to you regarding asthma education for adolescents. So we're going to talk about asthma today, and for those of us here in the group, you may have asthma and have had asthma since you were a child, or you may know someone who has had asthma, but just so that we understand what the disease process is asthma is really a syndrome that's either can happen spontaneously or that there is a trigger where the lung just becomes inflamed, and that inflammation causes a decrease in the ability of air to come in and out of the lungs. So when a person breathes in, it's hard for them. There's a tightness in the chest, and when they can breathe out, it's the same thing. It's hard for them to breathe out. So when the lung is not inflamed, how most people normally breathe in and out every day, but there's some sort of a trigger that causes a thickening and an inflamed response inside the trachea, which is the large tube in the chest, and then the bronchial tubes, which are the larger tubes that go into the right lung and the left lung. So again, it's a narrowing of the airways. Those are your big breathing tubes in the lungs. This is a reversible process. Although some people live with asthma type symptoms, that chest tightness, that hard to breathe on a daily basis, and that may be you, or you may know somebody in your family or have a friend that suffers with this. But there are medicines that can be taken that help treat these symptoms and prevent these asthma attacks from happening, and we will talk about that. Asthma is more common than people think, and I just wanted to share this with you. It is a chronic disease that roughly affects 300 million people in the world. That's 10 to 12% of current adults living that are affected, and 15% of children globally are affected with asthma. So in this slide, I have a picture of the respiratory system, and what we're talking about when you or someone you love or a friend has an asthma attack. If you look at the picture, there's the trachea, and then on both lungs there's the bronchial tubes, and then there's some smaller tubes when you go into the lung, the bronchioles, and it's those airways that you have to when you take deep breaths in that get swollen and inflamed, which makes the tube smaller for air to go in, and that's what gives it that tight feeling. The pathophysiology, and I don't want to talk at a level where you can't understand, but just to reiterate, the airways of the lungs are infiltrated with an allergen, and that allergen can be many, many things, and we will talk about that, but it causes there to be an immune response, and your body has these cells that it sends to that area, and they're called eosinophils and lymphocytes and mucosal cells that attack the allergen. The problem is that when all those cells are attacking that area, it causes the inflammation, and that's what causes the airway to shrink. So if you've ever had bronchitis, let's say you don't have asthma, but if you've ever had a bronchitis and it just feels tight and you're not able to take deep breaths, this is the same sort of process, if that makes it easier to understand. This is just a good slide that I felt gave a pretty good representation of what a normal airway, that could be the trachea, it could be the bronchus, it could be the bronchioli, but what a normal airway looks like, what an asthmatic airway, and when I mean asthmatic, I mean a chronic asthmatic airway, that there's some wall thickening and that the lumen or the opening to the airway has gotten smaller, and then the third one being the asthmatic airway during an asthmatic attack, where you can see the lumen or the opening to the airway even tighter. It's just a good picture representation of the three different types of airways. So what are some of the medications that are used to treat asthma symptoms? And asthma is so common that you or your friends, or you may have seen a loved one using those little puffers, and those are called meter dose inhalers, but they're little puffers that you have to put to your mouth and then trigger and you breathe in the medicine. But those medicines are called beta agonist, short-acting medicines. So for people that have asthma and maybe going along their day and there's some sort of a trigger and they get short of breath, they get that chest tightness, they're familiar with the feelings, you may see them picking up the little puffer and breathing in, pressing the button and breathing in some of the medicine. The two medicines that are out there that are most common that you might see someone use is called albuterol or Ventolin. There's another one that's called Xopenex. There's also, so those are medicines that patients take when they become short of breath. There's medicines that can be taken on a daily basis to help prevent the shortness of breath incident. So the albuterol, which can be taken in the puffer. There's tablets that can be taken every day. There's some aerosolized powders. One is called Foradil, and there's another one that's called Ceravent. And these are medicines that are dispensed sort of in a puffer capacity, and it's a powder, and the person just breathes those in, and it helps to prevent the patient from having an asthma attack. There's another version of inhaled medicine, and these are steroids. And steroids, if you've ever had to take them, even if you had an allergy issue or some other problem, steroids just decrease inflammation in the body. So there's some puffer type medicines that are steroids. One is called Symbicort, one is called Advair, and there's another one called Dulera, but that's only for kids ages 12 and older. And if you have asthma, you may be on one or a combination of these medicines. But these are all inhaled medicines, so you're breathing them in. Some side effects from these medicines is there can be some nervous or shaky feelings. Sometimes people who take them can have an increased heart rate, or it feels like their heart's running fast. There can be an upset stomach. There can be trouble sleeping and muscle cramps as well. If you are a person or if you know someone that is taking the inhaled steroid, which is a maintenance medicine that someone with asthma, chronic asthma, takes every day, there could possibly be yeast infections in the mouth and possible hoarseness of the voice. So the best thing that we advise patients and tell family members to remind patients is to, once you take your inhaled steroid, the Symbicort, the Advair, Dulera, that you gargle your mouth with water. The other thing that you can do is use a spacer device, and there's going to be a picture of that in another slide. Okay, in this slide, I just wanted to show a few pictures of using the puffer or the inhaler with a spacer and what they look like. And again, you may use one, or you've seen a friend use one, or you've seen a loved one use one. So there's the red puffer. The medicine dispenses out of the top. The person presses that on the top, and when they press it, they put that to their mouth and take a deep breath in, and the medicine comes out, just like you have in that one picture. There's also this other picture of a child using the puffer or the inhaler with a spacer. So you would put these two pieces together, put them in your mouth, press the inhaler, and that medicine goes into this spacer, and then you breathe it in. And the spacer just guarantees that you're going to get more of the medicine into the lung instead of it potentially all that medicine, that mist, shooting into the back of the throat. So it is recommended that you use an inhaler with a spacer. The other picture is just a nebulizer, and this is another way to deliver medicine, and this is more of a mist, and that's a pump at home, and you have to put the mask on, and it delivers the medicine in a vaporizing capacity with smoke coming out of the mask over 5 to 7 minutes. Just different ways to deliver the same medicine that help open up the lungs and get rid of that chest tightness. So what are some of the triggers for people that have asthma. What can cause an asthma attack? Sometimes exercise and increasing the amount of oxygen that's needed to the body can cause an asthma attack. Cold air, for people that live in cold air climates, breathing in that cold air can cause a tightening of those large airways. Different allergens, a very common one are dust mites. But dust mites and animal dander is a big thing. There are patients who have chronic asthma and they know what their triggers are, what causes the attacks. Some patients cannot have animals, cats, dogs, anything that is has dander in their house. So that can be something, that a modification that can be done for someone who is suffering with asthma, that they just can't have pets or they can't be around pets. You may also find there are people that have chronic asthma that are unable to have carpet in their house. It's hard to believe, but carpet can cause dust, so sometimes they have to get rid of the carpets in their house. Whatever modification can be done to try to minimize asthma attacks. Secondhand smoke. Obviously, smoking is completely ill-advised if you have asthma, as inhaling smoke can be a trigger to cause the inflammation, and smoking also causes damage in its own capacity. But if you have a parent, if you're around people who smoke, if you're around friends who smoke, that smoke can be an irritant to the lung and cause an asthma attack. There are some people that food can cause an asthma attack. Some people can be allergic to shellfish. Some people can be allergic to peanuts. And just like when they're having allergic reactions to the food, it causes a tightening in the airway. So shellfish, peanuts, it may be another food, but those are the most popular. There's also some medicines that can cause there to be a chest tightening and the shortness of breath. And the most common grouping of medicines are called non-steroidal anti-inflammatories, but those are things like Motrin or Tramadol. And if you're an asthma patient and this is your trigger, you usually know what those medicines are. So what can we do to try to prevent asthma attacks? What can you do to try to prevent asthma attacks? The first things first is to go to the doctor and see your doctor regularly, so that you can communicate with the doctor about how often you're having asthma attacks. So see a doctor or see an advanced care nurse practitioner. Take your medicines as prescribed. If you have asthma or someone you love has asthma and they have prescribed medicines, make sure that you're taking them appropriately. Have a clean environment, minimal dust and mold, as I mentioned earlier. No pets if animal dander is a trigger. Be mindful of perfumes and scents, as they can be a trigger, which can be hard to navigate because there are people that wear perfumes and deodorants and scented candles and scentsy things. But if you're suffering with asthma, and you know what the triggers are, you just have to be mindful to avoid those sorts of things in the air. The other piece is get adequate sleep, get adequate nutrition. Get a flu shot to prevent illness that can act as a trigger. Sometimes you can get a cold and you can have a virus, or you can get sick and that can cause an issue. There's a picture here in this slide of a little contraption called a peak flow meter. You can check your peak flow meters daily with a home meter, and this is just a little meter that you breathe into, and it gives you a number to let you know how tight your airways are that day. And if you know what they are every day when you're not short of breath, when you have an incident and you start to feel short of breath and chest tight, then you know how decreased your airway is moving air. The other the other picture in this slide is a pulse ox, and you can check your oxygen levels daily at home. This is a little clip that you put on your finger, almost like a clothespin, and it reads the oxygen level in your blood. If you check that every day, especially when you're not having symptoms, you'll know what your baseline or everyday oxygen level is, and then if you start to feel short of breath and you see a decrease in that number, then you'll know I need to take some medicines or I need to make a change. All right, the last slide that we're talking about is health promotion for adolescents, and adolescents being kids in your age group. And it's real important, and we as nurses and doctors, we understand that there's social pressures regarding fitting in at this age. Nobody wants to be the kid that stands out. So I just wanted to talk a little bit about social pressures regarding that and taking medicine. I'd like to believe that asthma is so common that people and friends and peers may have seen a peer taking some of these medicines. But if you are a person that is suffering with asthma, or you have a friend that's suffering with asthma, and it's embarrassing that you don't want to be the sick kid, or it's embarrassing that you have to take the medicine, you can go to the nurse's office, you can step away from your friends, you can go into a bathroom and take the medicine if you need it. The point is that we want you to take the medicine. Please don't avoid taking the medicine and letting an asthma attack get more severe for yourself. Or you can just explain to your friends, to your peers, that I have asthma and I have to take this medicine. Avoiding certain foods that we talked about earlier. If you are a person that has a food trigger for asthma, you're going to have to talk to your friends, going to have to talk to teachers, going to have to talk to schools that there are certain foods that you just can't eat. The other piece of it is if your best friend in the whole world has animals and you want to spend the night at their house, this can be a little bit of a challenge for you. And it may be that talking with the friend's parents, or talking with just your friend, saying, hey, listen, I would love to spend the night, but can we put the cat up? Or, what can we do so that I don't have an asthma attack and get sick when I come over? Or maybe you have the sleepovers at your house. It's hard at times to navigate asthma, especially when there's a lot of social things that go on when you're a teenager. But I think if you're talking with your friends, talking with friends' parents, talking with teachers, talking with coaches, that some of that can be easily navigated. I hope that this presentation was easy to understand. Thank you for your time.